Great. I think we can get it started. Okay, good. Hello, everyone. If you ever joined the Mira webinar, you know I'm Sylvia. I'm the CEO and the co-founder of Mira. And today we're really happy to invite Dr. Amina. So Dr. Amina focus on PCOS and she's based in UK. And though you might or may not be aware that this month, September, is a PCOS awareness month. So we have been doing a series of webinars focusing on PCOS and how to get conceived with PCOS, how to improve your condition if you have PCOS. So, PCOS is a really popular disease, unfortunately. 10% of global women have that. So today we're gonna share more information together with Dr. Amina. So maybe Dr. Amina, you want to introduce yourself?
Hello everyone, welcome. So yes, my name's Dr. Amina Hersi and I'm a general practitioner. I'm based in the UK and I actually have polycystic ovarian syndrome because of that I decided to start the PCOS Doctor, which is my Instagram page where I put little infograms based about polycystic ovarian syndrome. Sorry, Sylvia, do you want me to get my slides up now?
No, just if you want to do your introduction, we'll get to your slide in a minute.
Okay, all right, sorry.
Bye. Great. So thanks for your introduction, Dr. Amina. So before we start, if you're new to Mira, I'd like to, give you a brief overview. Mira is the fertility tracker, obviously, and the Mira helps you to get pregnant, avoid pregnancy, or just track your hormone. So the biggest value or the most most differentiated feature Mira has is we track your numeric hormone concentration. So when you buy the OPK or like the test strip, they usually just give you a positive versus negative estimation. But since everyone's different, everyone has different hormone curve, hormone pattern, and the peak value, base value. So if you just say, oh, I'm positive, I'm negative, that's very weak. And especially for people with PCOS, your hormone tend to fluctuate, and you tend to have a higher baseline for certain hormones. So you would like to know the numeric hormone concentration, like where the hormones are actually at. And unfortunately for now, if you want to know that, you have to go to do blood drawing, and which is impossible to do every day, impossible to track it for long term. And that's why we invented Mira. So with Mira, you can track your actual hormone concentration, like the hormone numbers down to a number with your urine sample at home, and very easy to use. And also the app, Mira app, will analyze your data, will provide you personalized analysis. So for example, if you have PCOS, when your ovulation really is, and if you should test again for this cycle, maybe the last surge wasn't an ovulation surge or something like this. And you can track it very easily for long term, so you can see if your PCOS condition is improving or not. And in addition, Mira tracks multiple hormones. So we not only measure your LH, we just launched the estrogen test once this week as well. So you can track both of your hormones, and we are launching the progesterone and the HCG testing for next year. So that will confirm the ovulation, which is very important for people with PCOS as well, because sometimes we're not sure if we actually ovulated or not. And the HCG can tell you if you have any sign for miscarriage. We don't want to have pregnancy loss. So that's a little bit information about the Mira. And then, before we continue, obviously we want to make sure we're doing all this for you as the more likely advices, info for your information. It's not gonna replace your medical advice from your doctor. So I'd like to know a little bit more about you before we hand over to Dr. Amina. So I'm gonna put a poll onto the screen. If you could kind of let us know more about yourself, so our topic and our conversation can be more useful and more effective to you. I'm gonna give 5 more seconds. Great, thanks for your input. Okay, I want to share our results with you guys. So you can see the results right now. So most people use calendar methods to track the cycle, which is great. And then some people use Mira, some people use OPK and BBT. Great. Thank you so much for that. Okay. So while Dr. Amina talk and you guys can ask your questions, we want to make sure this webinar is useful to you. It's your time, so we want to make sure it's really helpful to you. So when you ask the question, please make sure you type your question under Q&A, okay? And if other people, you say you like the question or you have the similar question, you can upvote that. And after Dr. Amina's presentation, we're gonna answer the question in the order of popularity. So please feel free to type in the question anytime and upload the question you like, and don't ask the question into chat, because that it's not possible for everyone to upload those questions. So make sure you type into Q&A. Thanks for doing that. And so without further ado, and I stop the screen share, and Dr. Amina, if you wanna share your screen, and we're excited to hear what exciting information you want to share with everyone.
Perfect. Thank you, Sylvia. Hello, everyone. I'm just going to reintroduce myself really quickly. So I'm Dr. Amina Hersi. I'm a GP, and I run the Instagram page, the PCOS Doctor. So I actually have suffered with PCOS. I've had it for over 10 years now. And I remember when I was first diagnosed, just how scary and overwhelming everything was, in particular, the myths about fertility and how it was going to be impossible to conceive with PCOS. So I'm going to be debunking a couple of those sort of ideas. I understand that most people who are attending this webinar today will probably already have a diagnosis of polycystic ovarian syndrome, but I just wanted to really quickly just have a little overview in case anyone here thinks they may have it. So it's a very complex condition with, there are lots of hormonal imbalances that occur, but it looks really simple when I say, oh, there's 3 criteria and you need 2 of those to have the syndrome. But I assure you, for some people, it can take a while to be diagnosed. So one of the first things I wanted to highlight is the criteria, the Rotterdam criteria we use. So firstly, it's excess androgens. So androgens are used to describe male hormones, but of course we all have a small amount of them. But in PCOS, it can be higher than usual, and that leads to side effects or symptoms such as unwanted body hair and acne, and either hair loss or hair thinning. This is identified through a blood test. The other way that it can manifest is irregular cycles. So PCOS is associated with absent or irregular ovulation, basically, and that causes disruption to the menstrual cycle. So you could have less than 9 periods a year, which would count as infrequent, or you could have less, or you could have completely absent periods as well, which would mean no periods for more than 3 months at a time. And I do need to just say that if that happens more than 4 periods, if you have less than 4 periods a year or have gone more than 3 months without a period, you must speak to your doctor so that that can be rectified. Now, the third thing is the polycystic ovaries. Now, we say cysts, they aren't cysts. They are actually immature eggs, and they appear as little pearls that they describe on the ultrasound. Now, having polycystic ovaries doesn't mean that you have polycystic ovarian syndrome. So that's a real important thing to note there. You could have the ultrasound finding, but not have any of the other factors. Okay. So in terms of polycystic ovarian syndrome, again, one of the first things that I was told about it was that it could make it really hard for you to conceive naturally. Now, that may be true for some women and it may not be true for others. Now, in terms of people who are struggling to conceive, a third of them have problems ovulating, and PCOS accounts for a lot of those people. So 80% of people with problems ovulating have polycystic ovarian syndrome, but this is actually one of the more treatable causes of fertility problems, because there are ways around it. If you can, pinpoint when you're ovulating, or if you can trigger ovulation, then you can hopefully fall pregnant, whether that's naturally or with a bit of help from others, including professionals like doctors. Okay, so there's no shame in seeking help. Now, I wanted to go through why it's hard to conceive in PCOS for some people. And to do that, I wanted to just sort of go through the menstrual cycle, which I'm sure you may have encountered in biology class back in the day, but I just wanted to refresh on that. So you can see in this slide, this is a classic 28-day cycle. Your cycle could be longer. Mine often is more than 60 days at a time, so it can vary from woman to woman. But anything above 35 days is deemed likely that you haven't ovulated. So that's something important to note. So we've got here at the bottom left-hand corner, the menstruation. So that's your period, usually 1 to 7 days, and is the beginning of the cycle. I've got all the main hormones that are important in the cycle here: estrogen, luteinizing hormone, follicle stimulating hormone, and progesterone. And I've separated the cycle out into 2 main phases, which is the follicular phase and the luteal phase. And right there in the middle, in that white line, is ovulation. Now that can on here it's happening at day 14, but it could happen anywhere between day 8 and day 21 of someone's cycle. So it really does vary from woman to woman, or from person to person. Now, the fertile window, which you want to make the most of, actually happens 5 days before you ovulate. And that's because sperm can actually live in your uterus for that period of time. And then the day after you ovulate as well, because the egg only lasts for 24 hours. And you can see here this yellow curve for luteinizing hormone. That you can see there's a little bit of a surge, a very high peak that happens a few days before you ovulate. And that is what some people can use later, I'll describe later on, to know if they're going to ovulate. So again, I just wanted to go in more depth into that menstrual cycle. So I've separated it out, the follicular phase in the beginning and the luteal phase towards the end. Now you can see it's not just your ovaries that are involved in the menstrual cycle, your brain is also involved as well. So here on the top left-hand corner on that follicular phase slide, we've got the pituitary gland, which produces 2 hormones, mainly follicle stimulating hormone, FSH, and luteinizing hormone, LH. FSH's main job is to stimulate those eggs to ripen, to become more mature. And actually, as they mature, they start to help produce estrogen, which helps produce the womb lining. Later on will be important in maintaining a pregnancy. And actually estrogen has a feedback. It feeds back to the brain and tells it to produce luteinizing hormone. And while that's happening in the background, you've got one egg that decides it's going to become the dominant one. And that later on should, under the effect of that LH surge, should actually leave the ovaries and go into the uterus ready to be fertilized. So that LH surge helps to make the ovaries a bit more permeable, sort of opens the door for that egg to leave the ovary. And now on the right hand side, on that other slide here, I'm describing sort of the second half of the cycle, which is the luteal phase. So when the egg is fertilized, it leaves a sort of jacket behind. And under the effects of hormones, that jacket becomes what we call the corpus luteum, which produces progesterone, and that maintains the lining of the womb. And actually, obviously, if you have your egg fertilized at that stage, the hormone HCG, which we use in pregnancy tests, then maintains that corpus luteum to keep the lining there so you don't shed it. But if you don't, if your egg isn't fertilized, or if you don't ovulate, then that lining will be shed because there's just no hormones maintaining it anymore. Now, in terms of why does PCOS affect the ovulation cycle? Well, if you look back at the pituitary gland, there is some studies that have suggested that women with polycystic ovarian syndrome have a problem with maintaining good levels of FSH, and sometimes their LH levels can be very high. And actually, estrogen and progesterone, which are more dominant in the other half of the cycle, they feed back to the brain to produce FSH again to trigger off another cycle. So if you don't ovulate and the next steps don't happen, you can get a vicious cycle where you won't ovulate the next cycle because you didn't ovulate the last cycle. And that's one of the theories. And the second theory is that, as I mentioned before, with the androgens, it can lead to a problem where the eggs, on the left side, the immature eggs are actually stuck in that immature phase. And again, if you don't get a dominant follicle, if you don't get the estrogen to promote the LH, then you won't have ovulation. And without ovulation, conception simply cannot occur. So that's the case for some women. Again, it's not the case for all. Now, if you are trying to conceive, then I've got a couple of tips here as a good place to start. Now, if you are smoking or if you drink alcohol, it's worth looking at those two things to stop, because that does have an impact on the health of your body and the health of your eggs as well. So it's really important that you seek support either through your doctor or a smoking clinic, or to actually quit. Now, I've got on here staying active with regular exercise. Again, physical activity is good for your physical health, but it's also really good for your mental health. So trying to conceive can be really, really difficult, and having an outlet, a physical outlet, can be really helpful along this journey. And again, the same with having good nutrition as well, eating wholesome foods that can improve your hormone panel. If you eat foods that are lower in sugar, lower in refined carbohydrates, and that also ties in with weight management as well. Now, I know that with PCOS, weight management can be really hard. And it's not that I'm just telling you to lose weight for the sake of it. It makes it easier if in the future you do need help trying to conceive. Having a healthy BMI will stop some barriers from getting in your way. So I do think that that's something to bear in mind early on in your life, before you've even thought about having children even. Now, supplements as well. So folic acid. Now, a lot of my patients actually didn't realize this, that if your BMI is above 30, you need higher levels of folic acid than you would get from the normal prenatal vitamins. And actually that needs to be given to you on prescription here in the UK by your doctor. So you need a high dose, 5 milligrams, at least 3 months before conceiving. And vitamin D as well. Here in the UK, we simply don't get enough sunshine. So government advice is that if you're trying to conceive, you need to take between 400 and 800 units of vitamin D a day. And the other aspect, I mean, it's quite obvious that you should have regular intercourse if you are trying to conceive, but we recommend 2 to 3 times a week, and that's every week, regardless of whether you're ovulating. And that's because it shouldn't become a chore. It can also put a lot of unnecessary stress on yourself and your partner, and it can take the importance out of intimacy. So we recommend that you carry on as you were, basically, and not turn it into something that's laborious. So now that I've talked about that, so how can we know that we're ovulating? And I know that from the poll, a lot of you are using ovulation sticks. Now, these sticks are used to detect luteinizing hormone, which I've said surges a couple of days before you ovulate. But these ovulation sticks are what we call a qualitative test. So they basically tell you, is my LH high? Yes or no? And unfortunately, as I mentioned earlier, women with PCOS can have high levels of luteinizing hormone in whatever stage of their cycle. So actually, it may say yes, but you're actually not ovulating. And that can be really disheartening. If you think you're ovulating and you don't conceive that month, you will actually, become quite upset about that, surely, because you would have thought, oh, it should have happened. And again, if your cycle is irregular, these tests are usually done on day 10 of your cycle. But if you're not sure how long your cycle is, it can be really difficult to know when to use it. So yes, it works for some women with PCOS, but if you have a high LH, then these tests are not going to be that informative about whether you're ovulating. So how can you tell if you're ovulating if you have polycystic ovarian syndrome? So the body gives some signs as well. So there's, for example, your discharge, your cervical mucus can change in consistency. It can become thinner and what they describe as egg white consistency, and that allows the sperm to swim easier towards the egg. And some people do use that to help them guess when they're ovulating. You may find that your body is, you may have a higher libido around that time, and it's, I guess, it's nature's way of promoting reproduction. Some people get mild spotting, so that should only really happen for about a day or two. If you're getting spotting between your cycles for longer than that, it's important that you do speak to a doctor about it. And some people, well, not some people, because of the hormones in the later half of the cycle, you might see an increase in your body temperature, usually by 0.2 degrees Celsius around the time of ovulation, roughly 12 hours before. Now, some people actually can feel when they're ovulating, and they might get some pain in their pelvis. It can alternate sides as well, depending on which ovary is ovulating that month. And then if you look on the right hand side, I've described a couple of fertility tracking devices. So we have here Mira, which is what we describe as a quantitative luteinizing hormone tracker. So it actually looks at the number of the actual figure for your LH, and because it's specific to you, it will tell you whether your LH has risen, whether it's the same, or whether it gives you a particular number, and so you can map your own LH surge before you ovulate, so it gives you some time. And the app will use artificial intelligence to monitor your cycle and will tell you when to test. So you don't need to think about, oh, is it day 10? Which day of my cycle is it? And I've actually been gifted a Mira tracker, and I've used it for a couple of weeks now, and I find it very easy to use. It's not invasive. I can just dip my urine, so I don't need to insert anything anywhere. Now, I know some of you are using the next option, which is the basal body temperature trackers, and they can be either internal or external, and they detect your temperature changes, but those tend to happen after you ovulate, so it can be a bit trickier to prepare for ovulation. And they also use artificial intelligence as well. So now that you've figured out if you're ovulating or not, if you are not ovulating, if you're not having regular periods, then I would say seek help actually from a specialist as soon as possible, because you can get some more help basically. And I got guidance here says, once you've tried for 12 months or so, but that's for people if they are ovulating. If you're not ovulating, please do seek help sooner rather than later. So in terms of things you can try to help you ovulate, again, weight loss, so even just a 5 to 10% change in your body weight can stimulate ovulation again in those who have stopped ovulating. And I know some of my followers, and including myself, use inositol. Understand that the evidence base may not be there yet. Research in PCOS is just not that in depth, but it has been shown in some studies to improve the hormone profile, so it can improve insulin resistance, and they extrapolate from there that it could possibly improve ovulation as well. And medication wise, we have metformin here, which was originally for diabetics to improve insulin resistance, and it has been shown to improve pregnancy rates in women or those with PCOS. Now, the other two medications are a bit more specialist, and I understand that some people may not find letrozole in particular on the NHS here in the UK, but clomiphene and letrozole can help improve the levels of LH and FSH to improve egg quality and make it easier for you to ovulate. Another procedure that may be difficult to get here in the UK, but is offered in certain places, is ovarian drilling, where it's a keyhole surgery or keyhole procedure where a laser or a small needle is used on your ovaries, and that helps to actually reduce androgen production, and again can help raise the LH and FSH levels and help you ovulate. And any of those options can then be used whilst doing IVF, where eggs are basically, stimulated and collected before being fertilized in the lab, before being inserted into a womb to hopefully end up in a viable pregnancy. So with all of this, I thought that it would be helpful to end on a positive note. And I just want to reiterate that people with PCOS can still have babies. It is not impossible. And looking at particularly this study that was conducted in Australia in 2015, you can see here that they had a group of women and they analysed how many of them had fertility problems, and 16% had infertility without PCOS and 72% had it with PCOS. But you can see in terms of the number, the one or more children, so they followed them up 10 years later, and they found that 62% of the women without PCOS ended up having a child in that period, and 60% of the women with PCOS ended up having a child within that 10-year period. So I just want to leave that in your mind, that it's not impossible, and you can help your hormones, and you can seek help from specialists, from doctors, to help you conceive. And I wish you all the best with your journeys, and I will hand you over now back to Sylvia.
Thank you, Dr. Amina, for that fantastic presentation. It was really helpful, and I learned a lot from you as well. So I hope that has been useful to our users. So before we go to the Q&A, I'd like to talk to a couple more minutes about how Mira can help you when you have PCOS, but you're trying to conceive. So as Dr. Amina mentioned, this is our hormone curve. So in your cycle, ovulation usually happens around the middle time, and before that you're in your follicular phase, and after that you're in your luteal phase. And there are multiple hormones that's regulating the ovulation. So actually ovulation is, you can think about this, the ovulation has been controlled by your hormone profile. And very interestingly, it's not being controlled by one hormone, as there's multiple hormones working in place. So they're like a cascade. It's like they're playing symphony. Every instrument, musical instrument has to play their own role in order for the symphony to work. And the hormone that's most directly related with ovulation is the luteinizing hormone. So that's the light blue color here. And that hormone usually surges, like increase sharply right before the ovulation. And that's the signal for the body to release the egg. But for people with PCOS, usually your baseline. So when you're not surging, the hormone's not surging, your baseline is high. So that's really hard for OPK or for, other some masses to detect where the real surge is, because it's always positive, it's always high. Your baseline is high, your peak is even higher. And for some other women with PCOS, they have multiple surges. So that means your body has been trying multiple times. So that, as Dr. Amina mentioned, you may have multiple smaller follicles and they are immature, right? So not every single one will be released. However, your body may tend to release those eggs multiple times per cycle. So you may have some smaller peaks and then have one big peak if the ovulation will happen, or you can have multiple smaller peaks and no big peaks, so nothing happened, no ovulation. So basically, from this you can tell that the hormone curve looks quite different than the like regular woman if you have PCOS, and you have to recognize a pattern in order to understand when ovulation happens. So that's a little bit feature for Mira. So if you got your Mira analyzer, you will say we detect your actual hormone concentration. So the good news is like right now you can measure both LH and estrogen hormone. So that will give you even longer fertile window if you're ovulating. And that can also reveal some hidden issues, some red flags, because the estrogen hormone is one of the most important female hormone. And the app will analyze based on your hormone number, will analyze when you're fertile, when you're not fertile, and also will tell you how fertile you are. So for example, this person has reached fertility score of 10. So that's a maximum for this month. So it's unlikely this person is ovulating today. And she is also, you see where she's in the cycle. This is your fertile window, this is a period. So it's really close to the ovulation. Great. So with that, I want to start to take some questions. I have seen many interesting questions, so thanks you guys for being really engaging. I want to answer the couple questions about the Mira first, and then I'm gonna give the rest of the question to Dr. Amina. So one question is about the estrogen testing. So is the estrogen testing going to happen with an app update, or you have to purchase a different type of test ones? So the answer is that you have to do both. So I believe the app is already updated. So I think it was released yesterday or midnight or something. So you should, if you have iOS, like you have Apple, like iPhone, this app should be automatically updated on your phone already. If not, you can go to the App Store and just click on downloading the app, and that will automatically update. So with this app, you can see both your estrogen and LH testing results, and the algorithm calculation will be based on both of these hormones as well. And in order to get your estrogen testing results, you have to buy a different type of test ones. So this test one is Olga already listed that into the Q&A. If you go to our website, you can see that too. It's called the Mira Fertility Plus test ones. So those test ones can test both LH and estrogen at the same time. So you only need to test the ones and got two numbers. And those numbers will be synchronized to the app, just like how regularly you're using that. And I saw another question about the Mira, which is the Boya was asking, I have a tendency to test with my LH level with Mira every morning. Will that skew my data with Mira? So the answer is no. So we know that most of the LH search is happening, actually showing in urine in the afternoon or so on, or at the middle of the day. But with Mira, if you test every morning, there's an algorithm gonna detect if your hormone has a tendency to go up. So this means when the algorithm says your hormone is about to surge, it will ask you to test again in 6 hours. So this is controlled by the algorithm, so you don't have to worry about that. And obviously, if you want to test multiple times per day, you can do that. It's not going to mess up with the algorithm at all. But the algorithm is managing that for you. So testing in the morning will give you really good, consistent measurement, say your hormone pattern across different days. And if the algorithm says you're about to ovulate, it will ask you to test again. So you're doing perfectly fine. So then with that, I see many questions for Dr. Amina. So I will start to go through that. So the first question is about my ovaries are bulky, and I would like to have some advice about how to reduce the size and reduce pain.
So in terms of bulky ovaries, I'm not sure how that was described to you. So each patient, I'm sure, you probably had an ultrasound or something that's said that you have bulky ovaries. In terms of me as a generalist, I am a general practitioner. I can't comment on very specific gynecological questions. So I don't know about this, how to reduce the size of a bulky ovary. But if that's something that, you know, someone else also wants to know, I can always do a bit more reading and do a post on it on my Instagram page. So I have to admit that that's not my area of expertise.
No worries, Dr. Amina. So also this girl asked another question. She said, what medication or a holistic method is best to increase the chance of ovulation?
So in terms of, you know, in the UK, you know, we are following evidence-based medicine, so we have to only recommend things that have been researched. Unfortunately, because polycystic ovarian syndrome isn't a very popular research area, not much has been done in terms of holistic treatment. So the only thing that may have a benefit that I know of that you can get holistically is inositol supplements. But if you check on my Instagram page, I have looked into certain things that some people have found helpful, such as spearmint tea, which can help with excess hair and androgen levels, and also even dietary changes as well, which can improve the hormone profile by reducing insulin resistance. So I'd recommend checking out my Instagram page. I have a few posts on that particular topic about holistic management of PCOS.
Sounds good. And how about the medication? Is there any medication that can help to increase the FSH level? So we're going to encourage the eggs to release. And she's asking, how about the Clomid? Is that safe, or what's your recommendation?
So Clomid is one of those medications that can increase FSH and LH levels and improve ovulation, but it is a specialist drug, so it has to be prescribed here in the UK by a fertility specialist, and there are side effects, which can include things like ovarian hyperstimulation, where your ovaries get too many eggs ready, and it can actually cause a lot of pain and can be dangerous. But again, that's definitely something that you shouldn't be getting over the counter. It should be given to you by someone who is a specialist and with specialist advice as well. Yeah.
Great. And we have many questions about medication. So another girl, Naha, she's asking, how about the inositol? So does that help with IVF or regulating ovulation, and how long does it take to be effective?
So in terms of how long it takes to be effective, that varies from person to person. The way that inositol works is a B vitamin, and it basically helps to improve insulin resistance, which can impact on your androgen levels, which can impact on your ovulation. So yes, indirectly it could help you ovulate, but again, the research just isn't there yet. It doesn't mean that it doesn't work, but if you are thinking about taking inositol, I do recommend speaking to your doctor, just in case there are other reasons why you shouldn't take it that we don't know about today.
Sounds good. And another girl, also about the medication, she said, how about the letrozole? And was that help with ovulation? And she has been 6 months with that, but there's no good news. So what is the chance of conceiving with this medication?
Okay, so with Clomid and letrozole, they are specialist drugs. Letrozole also increases FSH and LH levels, which can improve ovulation. In terms of actual numbers, I mean, there are a few studies that have suggested that around 27.5% of those who take letrozole will be pregnant in 5 cycles of that drug. And 61% of those with PCOS will ovulate whilst on letrozole. But in terms of, there are people who are resistant to these drugs, and sometimes they take them and it doesn't work for them. So I can't comment on individual cases, but again, I would recommend speaking to your specialist about that.
Sure, sounds great. So we have talked a lot about the medication. So another question, which is not about the medication anymore. So Christy is asking, can you have regular cycles and ovulation and still have PCOS? If so, how would you go about diagnosing that?
So as I mentioned at the beginning, there are three things that you can be used to help diagnose someone with PCOS. One of them is irregular cycles. So this person doesn't have irregular cycles, but the other two are the excess androgens. So either acne, excess body hair would be signs of excess androgens, and that can be identified through a blood test. And the other way that you can be identified as having PCOS is if you have polycystic ovaries on an ultrasound scan, which yes, so you can have PCOS even if you have normal periods.
Got it. Thank you so much, Dr. Amina. So I just saw another question about the Mira. So this girl is asking that she just purchased LH ones and she wants to exchange to estrogen ones. Is that possible? And also, how, are these, estrogen and LH, are these two wands or just one wand? So basically those are one wand. Okay, so estrogen and LH are now on the same wand because it will be easier for you to test. You only need to pee on that, actually not pee on that, it's more like a dip into the urine cup once, and you're gonna get two numbers at the same time. And if you want to exchange for estrogen ones, please contact our support team. I think it's possible if your LH ones are not opened. However, there might be a queue for the new product because this new product just got released and there are some pre-order people who pre-orders that has been waiting over there. But our support team can tell you the best information, most accurate information about what's going on. So if you want to exchange your test ones, or you have questions about the estrogen ones, how to use that or so on, please feel free to contact Mira support. Their email is support@miracare.com, and I will guarantee you they're gonna come back to you with the answer because they look at every single customer question. And I also have another question about Mira, and this girl is asking that if she wants to test with the estrogen ones, how many times does she have to test per cycle? So this really depends on your cycle length and your cycle regularity. So usually the app will tell you. It's a similar way of approach for the LH test ones. We will ask you to test more often when you're closer to your fertile window and closer to ovulation, and less often when you're far away. And once we detect your ovulation, you don't have to test anymore. You could test if you want, but you don't have to because you where they found your ovulation. So usually it's not gonna be too much more than the LH ones. I would say maybe about 10 to 20 per cycle, tests per cycle, depends on your cycle length. Hope that answered your question. So another question for Dr. Amina. So this girl is asking that with PCOS, it's not guaranteed that we will ovulate in between cycles. Is that right?
Yeah, that's correct. If your cycles are long, longer than 35 days, then it's likely that you haven't ovulated. So yes.
Got it. So another girl is asking that any supplements recommendation you have for people with PCOS?
So supplements that I mentioned during the talk were folic acid, and if your BMI is over 30, then it should be a high dose of folic acid. And if you are taking, we also recommend taking vitamin D as well. And again, earlier I mentioned that there could be some benefit to taking inositol, but again, the evidence isn't quite there. And there are other supplements, again, I mentioned on my page, the PCOS doctor on Instagram, including things like spearmint tea, which could help with excess body hair. But have a look. I've gone through the pros and cons of different supplements on my page.
Great, thank you. And a couple other questions about dietary recommendation. So is there certain diets they should be taking, and should they cut dairy or should they cut gluten? Was that help or yeah?
Okay, so this is something that a lot of people are doing. They're cutting out dairy and they're cutting out gluten. Now, I personally don't agree with cutting out dairy or gluten. Based on what I've read, it looks like cutting out gluten reduces the amount of refined carbs you're having. And I think that benefits you're seeing with that are more to do with the fact that you're having less less sugar basically in your diet, which will impact on your insulin resistance. So in terms of what diet to follow, I'd say do what works for you. If some people follow dairy-free, some people follow gluten-free, some people follow the keto diet, some people follow low carb but not keto. I would recommend reducing the amount of refined carbohydrates, which is sugar, you know, white pasta, white grains, and trying to go for more nutritious, wholesome, low glycemic index foods. So yes, I do think diet can impact on your insulin levels and thereby your hormones as well.
Great, thank you. So then we got a series of questions, like a miscellaneous question about the period, about the hormone pattern. So one girl is asking, can you tell from your periods that you have ovulated?
From the way that your period looks, I don't think you can tell from that.
She meant the timing of the period.
The timing of the period, yes. So if your periods are regular, you are more likely to have ovulated. So if you're having regular periods and they are occurring less than every 35 days, but obviously not too quickly either. If you're having periods every 2 weeks, that's not a great sign either. But if they are 28-day cycle to 28 to 35 days, you're likely to have ovulated.
Great. And for the hormone profile, how about she has many small peaks? Does that mean she is not ovulating?
So the small peaks, as Sylvia mentioned earlier, the small peaks can be sort of your body trying to ovulate, and you may have a larger peak afterwards. And some people don't have the larger peak, they just have small peaks. So a small peak doesn't mean you're not ovulating. It can be individual to you. A peak is a peak. So that could be your LH surge. So it doesn't mean that you're not ovulating. But if you're not having periods, then or having long cycles, then that probably indicates you're not ovulating. But again, speak to your doctor.
Sure. So baby, what you want to do is, like, you know, after you speak with your doctor, maybe what you want to do is that you can try to have sex when you see the peak, although that's a small peak, because you never know which peak is a big peak for PCOS.
And that's why it's worth having intercourse every, you know, two to three times a week, just to, you know, catch any particular peak.
Yeah, exactly. Great. So another question from Anna. So she says, when you see the egg white discharge, when do you start having sex?
So I'm not exactly sure of the exact timing, but you tend to see it pretty much when you are ovulating. As soon as you've seen that, you should probably start having intercourse to improve your chances.
Right. So basically, the egg white discharge is a result of hormone change as well. So usually, your estrogen hormone will increase when you're getting to your fertile window, and then your body will have this egg white discharge. And as Dr. Amina said, you're trying to conceive. You want to capture the time before and on the day of ovulation, not after, because our egg only lives up to 24 hours after it's being released. So there's a minimal chance after ovulation to get conceived. So when you say the egg white discharge, usually that means your body is about to ovulate. So you should have sex. I think you should have sex immediately, and then maybe for the next couple of days or so until the ovulation is done, and which you can see by, you know, tracking with Mira or tracking with other methods. You can see your hormone curve will go up and then come down. And you know, going through that whole period, maybe like once per day or something, if you want to maximize your chance to get conceived. Great. So another question is, can periods become regular after? Okay. So the question is, sorry, can periods become regular after miscarriage with PCOS?
So I'm assuming that the question is asking if a miscarriage can make your periods more regular.
Yes.
Not necessarily, not particularly. I mean, it shouldn't make any difference in terms of that. It can be a bit difficult for your cycles to go back to normal after a miscarriage. Some people have delayed periods after a miscarriage, but I've not heard of the opposite. But it's not something that's routinely taught.
Got it. So Ala also has another question. She says, if someone's underweight, do they need to take folic acid as well?
So we recommend everyone who's trying to conceive should take folic acid because it's important in maintaining the nervous system of the fetus. So if you fall pregnant, you need to have been on folic acid for the first at least 12 weeks. So yes, if you are not over 30 in terms of BMI, then you take the normal levels of folic acid, which will be found in most vitamins specifically for conception. So 400 micrograms of folic acid.
Mm-hmm. And another question for period and cycle. So Laura is asking, if you don't ovulate, can you still have a period?
If you don't ovulate, can you still? Yes, you can still have a bleed because that lining of the womb that's built up will have to go somewhere. So yes, some people still get periods, but they haven't ovulated.
Mm-hmm. Mm-hmm. So a girl is asking, what is the best time to test with the LH with Mira? So I think we kind of addressed that question already. We recommend, you can test anytime during the day, but you need to make sure you limit your water intake for 2 hours before the testing, so your hormone's not gonna get diluted. And this is especially true when you're at your baseline, because your hormone concentration is already low and you want to make sure you have enough hormone over there so Mira can detect that. And also make sure you test roughly at the same time every day so your data are comparable. You can take with your first morning urine, but you don't have to. We don't say you have to taste, we don't say you must test with the first morning urine, but many women choose to do that because it's easier, it's convenient for them to do so. Okay, so let's see what other questions we have. So Regina is asking about how can you tell if you're ovulating? So maybe Dr. Amina, you can take that question first, and I'll see if I have anything.
So as I mentioned in the slides earlier, you can tell if you're ovulating through your body. It gives you certain clues. Egg white consistency, discharge. It can happen where it thins out and it makes it easier for the sperm to go in. Or you can find that some people get some spotting and only lasts for a day or two. Some people will have increased libido, a higher sex drive around the time of ovulation. And some people's temperature might go up as well. And then one of the other ways that we've been talking about today is using a tracker such as Mira to check your LH levels, so you can find that hormone surge that happens just before ovulation. And some people actually can feel when they're ovulating, they get pain in their pelvis as the egg is released. Yeah.
I think the key here is that you want to really pay attention to your body, because your body will give you a lot of clues about ovulation. I started to do this when I started the company Mira, and I think I know many clues about my body, and everyone's slightly different. Obviously, testing the hormone might be the most accurate way, because hormone is a cause of ovulation for your body. So hormone will first increase. Your body is regulated by the hormone. They're like the, how to say that, like the conductor in a symphony. And the conductor said, okay, this instrument needs to play, and the instrument will go to ovulate. So it's more like this. But there's many downstream changes that will happen to your body. I think the mucus is actually a pretty good observation. I've been using that for myself. I think that's been really effective. Usually around the days of ovulation, you can clearly see your mucus will change, but that may take you few cycles, like 3-4 cycles, to see what is in an ovulatory mucus for you, right? Because everyone can look a little bit different. So that's really a good sign as well. And as Dr. Amina said, your body temperature tend to increase as well. But basal body temperature increase usually after ovulation. So you don't want to solely rely on that to detect ovulation, because that may be too late. You might be missing the majority part of your ovulatory window until it's really late. So usually we recommend the users to do multiple things together and be more mindful to your body, and really try to learn what's going on. And you will find that that's really a fun process, and you feel much better control about what's going on. Okay, great. So we got another interesting question about Mira. Say for women who have been using Mira, what is the average time taken for them to get pregnant? I think this is really interesting information. So this really varies because everyone has different condition. What Mira can do is Mira help you to pinpoint to what's going on with your body and help you to go through the process in a scientific way, and also help you to really see what's going on with your body. So that clarity really give people much more feeling like a stress-free, better control. And that's very helpful when you're going through a tough journey, like trying to conceive. So to answer your question, I think average probably about 3 months, but everyone really is different. We had some really, very impressive cases. People with PCOS never been conceived for 2 years, after 2 years of trying, and got pregnant in the second cycle. And people had the multiple miscarriage before, and also got pregnant with the third cycle. I have those very specific cases over there. I think actually many cases are posted on our Instagram account and also Facebook group, and you're welcome to check it over there. We also have a Facebook community on Facebook, so people share their experience about Mira. People share, provide support to each other. We also have Mira support team in there too. So in case people have technical questions, they can get them answered on time. So then, and final question for Dr. Amina. So where can we find you? We got many audience here interested to schedule a private meeting with you. So where can they find you?
So I work for the NHS, so you have to be registered at my surgery to do that, but maybe it's something I can offer in the future, who knows. But for now, you can find me at the PCOS Doctor on Instagram, and I'll be doing lots of posts about different things to do with polycystic ovarian syndrome, and maybe I'll be doing some Q&As hopefully in the future. But yes, you can find me on Instagram.
Great. So for any questions we don't have time to answer here, if that's a Mira question, feel free to send an email to support@miracare.com. And if that's a question for Dr. Amina, feel free to reach out to her directly. And for replay of this webinar, Olga already answered. You can go to our YouTube channel, Mira Fertility YouTube channel, and I'm pretty sure it will be uploaded there either in a couple of hours or tomorrow, because I believe it's already nighttime in UK, right? Yeah. So also I believe everyone will get the email about the replay latest by tomorrow. So before we finish, I'd like to share one last thing with you guys. So we have a special coupon for the participants for this webinar. So if you're new to Mira, and you can get £25 off using this code. The code is PCOS Doctor, and just feel free to go to miracare.com and you can apply this coupon. And this will apply to both the LH test kit and also the new Estrogen Plus LH test kit. That's a new product just being shipping today. Actually, I think shipping today, and also the app just being released today. So we look forward to your feedback, look forward to help more people like you. So with that, we already gone through this. So with that, I really like to thank everyone for your time, and especially thank Dr. Amina for your time, and we look forward to help more people. If you have any questions, feel free to reach out to us. And everyone either have a good day or have a good night.
Yeah. Thank you for having me. And I just wanted to say, if you have questions for me, please leave a comment on the post rather than a DM. I can't answer DMs for legal reasons, but it's safer to just leave a comment and I can answer your question there, hopefully, or through a post. Thank you for coming, everyone, and thank you for having me, Sylvia.
Thank you so much, Dr. Amina. Bye.
Bye.